Kidney stones generally are calcium-based collections that occur in the kidney, not usually because of calcium intake, but an abnormality metabolically in the way the kidneys are filtering or the urine that is being produced. So the kidneys end up being somewhat victims of the environment in which they live. Certainly climate, diet, groundwater, profession, all these things play a factor in the development of kidney stones.
Well, I started with what I thought was a urinary tract infection, and I had been to my primary care doctor for about 2 months, and he kept prescribing antibiotics, but that wasn't helping. And it wasn't until I was doubled over in pain that I went to the emergency room, and I was lucky enough that Dr. Davidson was on call that weekend. And that's when we discovered I had a large kidney stone that I needed to have removed.
With kidney stones, either you pass it, we go get it with the camera and use a laser to break it up, or we use a minimally invasive technique called extracorporeal shockwave lithotripsy that vibrates through and causes the stone to break. In this patient's case, she's unfortunately suffered multiple stones in both kidneys over the years and has required all 3 methods to treat her stones.
Kidney stones are not fun. My father had them, I discovered. Now I've had them for about the last 11 years, and some of them really large. Some of them have measured almost 8 millimeters across, the kind of egg shape mine tend to be, and made of calcium, which is the kind that there's nothing you can do. The only thing I can kind of do is watch my diet, maybe less salt, things like that.
So it's important that they drink lots of water, and at the first sign that there's an issue, be evaluated.
I feel like he takes great care of me, his bedside manner. He's conservative in his care, but yet he lets you know what's going on and gives you your options for you to decide what you need to have done. So he's definitely one of my top-notch doctors that I call on.